Hi everyone! I hope you're all doing well and are safe. Welcome back to the next episode of Cancer Behind the Scenes as presented by Cancer Together. In today's video, we'll be getting an overview on some of the different types of treatment options. Here's just a short reminder. Make sure to check the official Cancer Together website for any updated information on this series, to watch the YouTube video when it drops, and to play the educational game, which in this case is a Kahoot, to help retain the information in a fun, interactive way. Before we get into any new content, let's just revisit the previous video and recap briefly. So last time, we went over what a tumor is, the differences between benign and malignant tumors, and a bit about when a benign tumor becomes malignant. And after going through all this information, it might be a bit curious about what different types of treatment options there are after diagnosis. Well, that's the focus of today's video, so with that being said, let's continue. To start off with, let's talk a bit about cysts and tumors with relation to treatment. As we touched on lightly last time, pathology reports can give you the specifics about the tumor and its condition, like whether it's cancerous, if it's in its primary location, and so on, to help guide your treatment plan. Most cysts are not going to require removal, but if it's painful or you don't like how it looks, you can have it removed or the fluid within it be drained. Something to keep in mind though, however, is that if you do drain the cyst, there will be a possibility of regrowth and a need for complete removal. Similarly, benign tumors don't usually require treatment, but it can be surgically removed if the tumor is causing problems in a nearby area. Malignant tumors, on the other hand, almost always require some form of treatment. Of all the common treatments, the ones best known are surgery, radiation therapy, and chemotherapy. In fact, you probably have heard of at least one of these three. Surgical removal, also known as curative or primary treatment, is used to remove the tumor and some of the healthy tissue around it called the margin, and this can be the only treatment one patient receives while used in combination with other treatments for others. Radiation therapy is another form of treatment that uses, you guessed it, radiation beams on specific points in the body to help kill cancer cells. While radiation is likely to injure healthy cells, the damage isn't permanent because these cells have the ability to recover from radiation. Next, we have chemotherapy, which is a systemic form of treatment, meaning that it affects the whole body. It's an aggressive form of chemical drug therapy that destroys quickly growing cancer cells. An important note to highlight here is that while it's shown to be effective in attacking cancer cells, it can also cause some serious side effects. And then we have our last two treatments that we'll be talking about, targeted therapy and immunotherapy. Targeted therapy is essentially when drugs or other chemicals block cancer growth by interfering with specific molecules involved with the growth, progression, and metastasis of cancer. And last but not least, we have immunotherapy or biological therapy, and it's a type of treatment that uses substances made by the body or in a lab to improve the immune system and destroy cancer cells. And I believe that's a good place to stop. Thank you for joining us today for this video, and I hope it was informational and interesting for you all. Remember to play our educational game to review the information in an interactive way and to keep an eye out for when the next video drops. Thank you all again and have an amazing day.